Wonderful. So again, good afternoon, everybody. My name is Katie Basaha. I'm a program officer at the New Jersey Healthcare Quality Institute. And the goal of the Quality Institute is really to improve the safety, affordability, and quality of healthcare for everyone in New Jersey. And one of the ways that we do this is through our COYL program. And COYL, or Conversation of Your Life, is an initiative of our Mayor's Wellness Campaign that aims to provide communities throughout New Jersey with resources, educational programs, and connections to subject matter experts and speakers on how advanced care planning is an essential part of health and wellness. And really, we're looking to empower our residents to discuss, document, and share their healthcare priorities. And today, for our COIL session, we're doing a learning session, and I have Lori Feldstein from the Goals of Care Coalition, who's going to talk a little bit more about the new community palliative care Medicaid benefit. And so I'm going to just kind of switch it over to Lori, and thank you all for being here today.
Thank you so much, Katie, and good afternoon to everybody. I'm so thrilled to see so many of you on the call. Some names I recognize, some new, but I'm particularly pleased about this tremendous interest in the community-based palliative care program. So if you give me 1 second, I will share my slides and we'll get started. Okay, so hopefully you can all see my slides. Katie, you're just going to give me a thumbs up. It's good. You can see it.
Yep. Yeah,
Great.
we can see
Okay.
it.
So I wanted to share a little bit of an overview for those of you who may not know the Goals of Care Coalition of New Jersey, to just give you a little bit of background information about our organization, and then really just jump into the topic at hand today and share with you some data around the state of serious illness care in New Jersey, and then to walk you through an overview of the new Medicaid Community-Based Palliative Care Program. And then, because so many of you are already engaged in community outreach and education, I want to share with you some information about a program that we are doing to help get information about the Medicaid benefit and specifically about palliative care in general to patients and caregivers in the communities that you serve. There are lots of ways that you can help ensure that this new Medicaid benefit is actually used by the people for whom it was built. And so I want to share with you some information about tools and resources that you can use in your own community engagement work. So I will, and of course, leave a couple of minutes at the end for questions, as I hope there will be many. Just a little bit about our organization. So we were founded back in 2018. The New Jersey Healthcare Quality Institute was one of our very, very first coalition partners and has been engaged in the work with us since the beginning. We are a nonprofit, an independent organization that now is working with over 40 different of our state's organizations, all trying to improve care for serious illness. And this work, our coalition really grew out of a statewide effort, an advisory council that was actually completed in Governor Murphy's administration around improving end-of-life care in New Jersey. And one of the actually the first recommendation of this Governor's Advisory Council was to create a coalition such as ours so that we could bring together all of the groups that were already working to try and improve care here in New Jersey for people with serious illness under kind of one umbrella. And that was really the basis upon which the coalition was built. These are the members of our coalition currently, and many of you are probably affiliated with these organizations or are working for some of these health systems. In general, the members of our coalition represent those interdisciplinary team members caring for people with serious illness. So it isn't just physicians, it's also nurses and social workers and community health workers and spiritual care leaders. It is also people caring for those who are dealing with chronic complex care needs in different settings, in the community, inpatient in a hospital, or even in subacute or long-term care. So our coalition is very diverse, but we all have really one vision in mind, and that is to ensure that all patients with serious illness get the care they need and no less, and the care they want and no more. And our organization today, we're going to talk a little bit about the advocacy work that our organization and our members undertook, which resulted in this community-based palliative care benefit. But we are also involved with research and education. And at the end of the day, really the focus of all of our work is trying to create a new standard of care in New Jersey where people with serious illness receive care that's consistent with their goals and with their values and that honors their dignity. So I want to switch gears for a minute and just share with you some data and information about the state of serious illness care in New Jersey. And for those of you who are doing this work day in and day out, I don't think this will come as a surprise. Unfortunately, New Jersey performs pretty poorly on standard metrics that look at serious illness care. In 2023, the Coalition to Transform Advanced Care published a paper that looked at various different metrics regarding serious illness care. And you can see here that New Jersey, unfortunately, is one of the worst performing states in the country. And what that means is that our patients here spend more days in the ICU, are getting more aggressive care with no better outcomes. Our patients with serious illness ultimately die in New Jersey, just as they do in other states all over the country. But our patients here tend to suffer more, and we tend to have much higher cost of care, 20% higher cost of care in New Jersey in the last 6 months of life than any other state in the country. So these are the metrics that our organization is trying to change. The reality is that in New Jersey, and many of you who work with seniors and with our aging population know that we are aging as a state faster than many of our health systems can adapt. We will, by the year 2030, have nearly 2 million older adults, people over the age of 65. That's 20% of our population living with their chronic complex care needs in the community. And these people are often relying on our already crowded emergency rooms, our hospitals and long-term care facilities, and the strain on our system, which is already a strained system, is something that we thought was a very important opportunity to improve care, and that is to bring care to the places where people are. And that is really the essence of the policy breakthrough that is this community-based palliative care program. Our organization and the members of our organization have been really a steadfast advocate for policy change that would improve care for people with serious illness. And as a result of the work we did with champions in our own state legislature, and ultimately with the Murphy administration, we are able to announce today that the community-based palliative care benefit for Medicaid recipients will be going into effect on April 1st, and we will be only the third state in the country to offer a Medicaid benefit like this. California was the first, and they've actually been offering this benefit there for nearly a decade. Hawaii was the second, and they launched their program about this time last year. But there are dozens of states behind us looking to do the same work. And I'm proud to say that, New Jersey will certainly be one of the states that many of those other states that are working on this will look to. And so there's a lot of eyes on our state and some benchmarking that I think we can be doing to show other states what good looks like. And that's going to involve all of us, including many of you who have the opportunity really to be on the front lines in communication and community outreach and education to ensure that people really understand what this program is and are able to access the benefit. So I just wanted to take a minute to talk about why we're so excited about a palliative care program coming to New Jersey. This new model of care, palliative care, is proven to both improve quality of life and reduce costs. Excuse me. So you can see some of the data on the bottom. Of course, the cost savings are a result of reduced healthcare utilization. And so the more care we can provide to people in their homes and in the community, which is really where people want to be, the more significant the decrease in costs associated with hospital care. And so what you see on the right is data that was published by the National Academy for State Health Policy that shows specifically in a Medicaid population the significant impact on cost. So per Medicaid member per month, for those enrolled in this program in California, the state was able to see a significant reduction between $231 and $1,165 per Medicaid member per month because they were doing a better job of delivering care to people who needed it in the community rather than in the hospital. I also just wanted to share a little bit of information with you about some of the research that our coalition has undertaken over the last couple of years to better understand where the gaps in serious illness care are in New Jersey. And this report is available. It's published on our website, and you certainly can find much more detail in there than I'll share with you today. But important to note that we found significant gaps in terms of care delivery for people with serious illness in New Jersey, in addition to serious disparities in care for particular populations. So what did we learn about access and equity? In terms of specialty palliative care, what we learned is that there's very limited specialty palliative care capacity in our state. So we know that there are nearly 80 provider organizations that tend to run along the New Jersey Turnpike that met our study criteria for delivering community-based palliative care, meaning there was a palliative care specialist involved in the program, someone board certified in palliative medicine, and that there was a full interdisciplinary team engaged in the delivery of that palliative care service. But we also found that there are many parts of the state, especially parts of the state where we know that there are many older adults and also a high percent of Medicaid patients. That's where you see those red circles on the map to the right, where there is very limited or very low access to palliative care in those communities. And that really, provides an important learning and opportunity for us to build capacity in some of those low capacity areas. Given the low capacity, it's not surprising that we saw utilization of palliative care services across the state as relatively low. You can see on the text box to the left, the national statistics. That is 1 out of 3 Medicare beneficiaries with cancer have accessed palliative care in the past, but our statistics are even lower. For patients with any type of cancer in New Jersey, we found that their use of palliative care was only 5.2%. And for even the sickest amongst those patients, those with metastatic cancer, The utilization for palliative care in our state was only 12.4%. So you can see we have a long way to go in ensuring not only that we have the capacity to deliver this care, but that we are connecting patients in need with those providers. We also saw in our data a significant variation in where that care exists. And so in places like Cape May County, for example, where we have a very high percent of older adults living, use of palliative care and the provider capacity in that part of the state is very low compared to other parts of the state. We also found significant gaps in equity. And what we know, New Jersey is an incredibly diverse state. We happen to be amongst the most linguistically and culturally diverse. But unfortunately, what we found in our study is that palliative care is always offered in English and only 36% of the time in Spanish. And despite the fact that we have large percents of our population speaking other languages, access to palliative care in their first language is not available. And that gap obviously contributes to significant barriers and impacts outcomes for patients with serious illness. We also spoke with hundreds of patients with serious illness across the state and learned, and this I am sure will come as no surprise to many of you, that there is significant conflation and confusion between palliative care and hospice care, and that it is very often, palliative care is very often perceived as end-of-life care, which of course contributes to additional barriers to access. So this is a big educational opportunity for all of us to be thinking about, and is certainly an essential component. This education and differentiating palliative care from hospice care is an essential component in a lot of the programs that the coalition will be undertaking in terms of outreach to the patients and caregivers. We also spoke with many older adults and caregivers about how they really want to learn more about palliative care. And we heard very loud and clear from people across the state that this is a sensitive conversation, sometimes a difficult conversation, and therefore it's important for them to learn about this from trusted sources in their community, whether it be their healthcare provider or the community-based organizational leaders that they recognize and that speak their language. And it's not only the message that matters. I think the learning we took away from some of this work is that the messenger also matters. So I just want to take a minute to thank all of you on this call who are those trusted messengers. Your credibility and the work you're doing in the community makes all the difference in the world. And we heard that over and over again from people we spoke to up and down the state. So I'll switch gears for just a moment and tell you a little bit more detail about the New Jersey Medicaid Community-Based Palliative Care benefit. First of all, it is intended specifically for New Jersey family care members with serious illness. So you must have a designated serious illness. We'll talk about that in just a second. And the care will be delivered by an interdisciplinary team with the goal of helping patients and caregivers to manage the symptoms and stress of their serious illness, as well as to help them navigate the healthcare system. Importantly, access to this program, eligibility for this program does not require that the patient have a terminal prognosis or that they give up active treatment for their disease. So that's a big difference from hospice care, and we'll talk a little bit more specifically about that in a moment. The whole goal of this program is to help improve quality of life for patients who are living with a serious illness and sometimes living for many years with that serious illness. And in the text box to the right, you'll see some of the specific services that are included in the community-based palliative care program. So it is things like care planning and engaging in goals of care conversations so that care can be aligned with patients' goals. It's care coordination, which we know, especially for someone who's dealing with multiple specialists or dealing with a number of symptoms that require addressing, that care coordination can be a real challenge. And so this service also provides a care coordinator as part of the interdisciplinary team. And then help, of course, with pain and symptoms, with advanced care planning, and then importantly, with also with spiritual care, emotional support, and support for the caregiver. And all of these services are available 24/7. That is a requirement for the providers who participate in the delivery of this community-based palliative care program. So important for you to understand that because palliative care, true palliative care, is provided by an interdisciplinary team, this benefit covers the entire interdisciplinary team. So patients who are receiving this care will continue to receive care for their primary serious illness. For example, if you're a cancer patient, you will still receive your cancer care from your oncologist. And then in addition, patients will have access to this additional layer of support, which are the interdisciplinary team of providers you see on the right. So in addition to your oncologist, for example, you would also have access to a palliative care doctor or a palliative care APN or PA. You will also have, based on the needs of the individual patient, access to nurses, social workers, community health workers, spiritual care providers, and be able to access that care 24/7. So I talked a little bit about who is eligible and what the requirements are. To the right in the purple text box, you'll see a couple of examples of the serious illnesses that are included. This is not the exhaustive list. There are a number of different serious illnesses that are included in this program. Also, if a clinician determines that a patient really needs this support, they can make the case for their patient. But in addition to having a diagnosis of a serious illness, the patient must also show some evidence of functional decline, whether that is in having difficulty with activities of daily living, having visited the emergency department 2 or more times within the past 6 months, or even having had a hospitalization within the past year. These are some of the very specific eligibility criteria or requirements for participation in this program. And the program is really accessed and can be accessed initially by the patient themselves or by their caregiver or by those of us in the community who are seeing that someone we care about is having some significant quality of life impact from dealing with their serious illness. And that step one of the process is filling out a very simple eligibility screener. And I'm going to show it to you in just a moment. It's 3 questions, and that can be completed by anybody. And that would then trigger a more comprehensive medical assessment, which would need to be completed by a provider in order for the patient to access this benefit or become eligible for the program. This is that very simple screening tool. There are 3 questions. Does the member have a serious illness? And you can check off the ones that they have or describe which serious illness the patient may have. Is the disease impacting the member's quality of life? And the last question, a little bit more open-ended, is what is the greatest need of this patient or their caregiver? That is all that is required to trigger then the more comprehensive medical assessment. There is a lot of information that is currently being provided by Medicaid, by the Department of Medical Assistance and Health Services. And that training, those training sessions began already. I think Beth will pop into the chat, she hasn't already, the link to the webinar that took place just earlier this week, which really provided a more detailed look than I just shared on the benefit overview and the covered populations, the services that are provided, etc. But there are 2 additional training sessions, and so I'd encourage everybody who may be interested in participating in this benefit as a provider to attend next Tuesday's session, which will cover specifically the credentialing process for providers, and then the 3rd training session, which will cover the role of the care manager, as well as billing and claims and additional information regarding provider tools. But registration is required. So again, I'd encourage you, if there's any interest in from the provider perspective in participating in this program, these training sessions will be very helpful. Okay, final part of my talk, and I want to leave us a few minutes for some questions, but I did want to share with you that the Goals of Care Coalition of New Jersey is launching in support of this Medicaid benefit, what we're calling our Ambassadors Program. This program is intended to identify and work with ambassadors, people like yourselves, community leaders, who are nurses or social workers or community health workers, faith-based leaders, leaders of community-based organizations, who we will train and support in community outreach and education efforts using a customizable program or customizable set of slides and resources that will help older adults and people with serious illness and their caregivers learn a lot more about what palliative care is and specifically how to access this particular benefit. The ambassador's job will be to provide accurate and culturally responsive information about palliative care to community members. Importantly, to share key differences between what palliative care is and what hospice care is, and of course, to introduce the details and some information around how to access the New Jersey Family Care Medicaid benefit for palliative care. We will also be encouraging patients and caregivers to talk with their loved ones and to talk with their healthcare providers about their needs and about their interest in palliative care. And ambassadors will be connecting people in need with information, resources, and tools. We are really focusing our efforts initially in a couple of key priority areas. They're listed down on the bottom of this slide. And the reason that we're focusing in on some of these key areas is because we know them to be significant areas of unmet need, but these are also parts of the state where there currently are palliative care providers. And so we're hoping that we can connect people in need with the providers in their community who can help improve their quality of life as they're on their serious illness journey. The Ambassadors Program is really intended to turn awareness into access. So we are really counting on our ambassadors to help people understand what palliative care is, how it's different from hospice care, to know when palliative care might be useful, and then ultimately to help prepare patients and caregivers for conversations with their providers about palliative care and to connect them with the important tools and resources required in order for them to access the benefit. There are lots of benefits of being an ambassador. If you're interested in working with us on this program, I'm going to put my information up at the end. Beth can pop our contact information into the chat. And we'd love to engage you in this work. But the key piece of this is really providing simple and consistent messaging. And I know many of you are out there on a regular basis talking with patients and family members and caregivers in the community. And I really want to emphasize the importance of our consistent messaging around palliative care in order to be able to dispel a lot of the myth and conflation with hospice care. So first of all, we want to make sure patients and caregivers understand that palliative care offers more than just the clinical care they're getting for their disease. It's that additional layer of support provided by all those other team members that can help with spiritual care needs, emotional needs of dealing with the stress of a serious illness, and many of the other services that we shared a little bit about earlier. It's for people who are living, and I stress this word living, living with serious illness. Palliative care is not for people who are dying. It is for people who are living many, many years often with their serious illness. And it's not just for the patient, it's also for their caregivers. And the intent here is to make sure that patients and caregivers understand that they have choices and that they can get care that specifically aligns with their goals. Just on the point of palliative care being different from hospice, this is kind of the way that we're positioning that. Palliative care is for living well. It is that extra layer of support in addition to the treatment, the regular treatment that patients may be going through for their serious illness, and it can be provided at any point in their serious illness journey. That's different from hospice care, which is really about helping people to die well. And the focus of that care is really on providing comfort at the end of life. So I hope this begins to help you understand the language that we'll be using to communicate about palliative care with people who may need access to this and not have necessarily the right perception of what palliative care is. Because I know there are many providers, physicians, and other healthcare professionals on the call with us today, I just wanted to mention very briefly another program that we're undertaking, which is a much more structured and clinician-led program to try and ensure that we are seeing more timely and more appropriate referrals to palliative care. So the focus of our Champions program is not on patients and caregivers. It's on the providers who are caring for people with serious illness, like oncologists, and even the primary care physicians and geriatrics who are seeing patients with serious illness on a regular basis. This program is really meant to address one of the most persistent challenges we face in palliative care, and that is late or absent referrals. So again, the focus here is really trying to provide some practical information to providers to ensure that they are connecting the patients they're treating with these services to help support patients on their serious illness journey. We're currently recruiting for both our ambassadors program and our champions program. So I mention it in case there are people you think might want to be involved in these programs. And that is it. I'll just put my contact information up there. I'll take down my slides. I'm happy to answer any questions in the last 15, 20 minutes we have remaining. So I haven't peeked into the chat. So if there's anything in there I need to be answering.
I've been trying to address them, Lori.
Okay, thank you. Thank you. So happy to answer any questions, or Katie, not sure where you want to take it from here.
Yeah, I think we can start with any questions. So we'll just give everybody, I know that sometimes it takes some time to unmute your mic and do all those things, but you can either unmute your microphone, raise your hand. Great. I see Reed Thomas. Feel free to go for it.
Just curious if any of the services that fall under this new palliative care benefit have any sort of offsetting effect to services somebody may already be receiving under their NJ Family Care, the PPP program, for example, care management for an MLTSS participant. The whole duplicative of service is usually a major issue. So I wonder if there's any, potential issues with that, with this new program.
Yeah, it's a great question. So patients will, if you enroll in this program, it does not mean that you will not continue to have access to other services that patients are currently receiving through New Jersey Family Care. This set of services is going to be reimbursed as a bundled per member per month reimbursement. And as long as those providers of the palliative care service are not sort of double dipping, you're already getting paid, for example, in the bundle per patient, per member per month for advanced care planning, let's say. So you can't also then bill for advanced care planning, but it does not preclude access to other family care services. So that is an important distinction. And much more detailed guidance will be provided by Medicaid. And so again, these are some of the questions that are very much that Medicaid is providing detailed guidance on in those webinars that they're hosting over the next couple of weeks, and will also be providing guidance documents for providers who are involved in this. So stay tuned for more from DMAS specifically about your question, and thank you. It was a good one.
Gotcha. So basically, the bundle is a service standalone almost as a billing item. It's not broken down into the components of the bundle.
Correct.
It's just one single line item, so it's not going to conflict with those other things that might be in a person's billing history.
Correct.
Gotcha. Thank you.
Lori, I'm just going to read a message from the chat from Miriam, which I think you touched on. So Miriam, if you have additional follow-up questions, feel free to unmute and just to share. So she wants to know, she understands the benefit isn't starting until April, but how would referral be made?
How referrals would be made into the program. So a patient, as I said, sort of step one is making sure just those 3 questions are answered. And if the patient has a serious illness and is having an impact on their quality of life, that patient would be take that information to their provider. It can be a primary care provider, it can be a social worker, it can be a nurse who would be responsible for completing that comprehensive medical assessment. That is in itself reimbursable under this program. And again, physicians, APNs, and PAs, and some additional other providers are going to be reimbursed for that comprehensive medical assessment. The patient would then that comprehensive medical assessment would then be provided to the patient's MCO. Their managed care organization would then determine eligibility, and if that patient is eligible, then their provider, either their primary care provider or their serious illness provider, if they're oncologist or whatever, could refer them into the program. I hope that made sense.
So there's one more question in the chat from Lena. Lena, I'm not sure if you're still online, but she wanted to know, had a question about the interdisciplinary team, and it'll be comprised of existing palliative care providers, but are new networks being developed?
Yes, absolutely. And you can see when, you look at the data that's published on our website, how limited care is in certain geographies in our state. And so there is definitely interest in wanting to help to build capacity across the state. So new networks are definitely going to be encouraged to participate in this program as long as they meet the specific criteria for being an approved provider. Some of that information was provided during the first webinar that DMAS gave, which there is a link to now. That webinar happened on Tuesday. So you can listen to that for more detailed information. But in the upcoming session, the session number 2, training session number 2, provider credentialing requirements are going to be reviewed. And I'd encourage anybody who's interested in building this network or in partnering, there are specific requirements around who needs to be employed by the entity versus who can be contracted with the entity. All of this information is included in the guidance documents and in the information that DMAS will be sharing during that webinar.
Do we have any other questions? Feel free to unmute your microphone or drop them in the chat. Anybody super excited for this benefit? I feel very excited for it. So yeah. Oh, I see Janice wrote, is there significant outreach to the area providers? So if I identify a hospital patient who seems to meet the criteria, I'm refer them back to their current team. Will that team be familiar with this program and how to complete the larger assessment? Great question, Janice.
Great question. That is the work that many of us in the state are undertaking, is about ensuring that there is awareness about this program. So, part of the champions work that we're going to be doing is speaking to those providers across the state so that they are aware that this program exists. But we're going to need as many partners in those outreach efforts as possible. So that's why we're doing meetings like this. Certainly the health systems across the state have been engaged and will be sharing information. For sure, the regional health hubs across the state that work very closely with family care are providing information not only to the patients and caregivers that they serve, but to the providers that are in their catchment areas. So I think there's a lot of efforts undertaken that are going to be undertaken to ensure providers know that this benefit exists. And we've published on our website a directory of palliative care providers by county. You can search by county. You can search by insurance that they take, etc. So we are trying to close that gap to ensure that potential providers who could be referring patients into these programs know that this program exists and know which providers in their community they may be able to refer patients to. Yeah, I see, Lisa, your question. We would love to have your organizations part of our coalition. Again, feel free to reach out to me directly. You can reach out through our website. The more people we have engaged in this work, we all know, we understood it couldn't happen with one organization alone. And that was really why the coalition was built in the first place. It's going to take this village really to support patients throughout the state and caregivers throughout the state. And because we know of the demographics in the state, The more of us engaged in this work, the better. So I really appreciate that question, Lisa, and I look forward to hearing from you and others who may be interested in participating in this work.
Great, great. I think we could still obviously have like room for questions, but I'm gonna just kind of do our last few minute spiel, if you will. And if anybody has any upcoming programs that are coming up or initiatives that they do want to share, feel free to drop those in the chat, and I can also share them out with the entire COYL partner list, as well as all the attendees for today. Um, and if there's anything that you want to share today that you're doing or that's coming up and you just want to kind of share it out to the group, you can unmute your mic or again, drop that stuff in the chat. Yeah. And we really appreciate your being here today and all these wonderful questions. Um, I know the like Zoom thing where it's like you're waiting for people to ask a question or say something. You give everybody enough of space. There's that comfortable in silence thing that I'm never very good at. So, oh, Anna. Oh, Anna, if you wanted to, I see your
Here,
hand
yes,
was raised.
I
Yeah,
just wanted to say thank you. Hi,
it's
how are
okay.
you? I was looking for my mouse on this three different screens, but I just want to say thank you for giving this information. I know we're very excited about that. I have several of my team members listening to this presentation today because this is something that, yeah, we've been waiting for a while to have something as a model like this that can provide all the support. And I'm very happy to hear that you guys are taking into consideration cultural barriers, giving the information in the language that the patient and the family understands, because it does make a big difference when you're having those conversations in a language that is comfortable for them. So thank you for that, and thank you for giving these wonderful presentations in the community.
Thank you, Anna. And we are, as I said, still recruiting both specifically for our ambassadors program, and we're going to need people who speak multiple languages, to engage in this work with us. So, if there are people that you might think of who might be interested in working with us, that would be great. A lot of the resources we have available on our website are downloadable for free in multiple languages. So, we've got some of the content, but we are going to need more people in the community to help connect people with those resources.
Somebody? Just a question.
Great. Yeah. Yes, with that being said, I know that there is no end to question. Oh, where can you get a copy of the slides? Lori, if I have your permission, I can send them out
Absolutely.
with
I
the
sent them
recording.
to you already in a PDF, which would be easier to send around than the PowerPoint. So please.
Yeah, great. All right. I think then we can give everybody a few minutes back to their day. But I really appreciate on behalf of the New Jersey Healthcare Quality Institute and COYL, we really appreciate Goals of Care, Lori and Beth for coming here, as well as everybody that was here today to learn a little bit more about this benefit, as well as the ways that you can get involved and hopefully spread the word and make this more accessible to the people that you serve. So thank you again.
Thank you all so much. And thank you, Katie. Appreciate the invitation.